You can still ask questions in clinical management. Ideally, you want to involve your patient. If you're not asking them any question, you're just lecturing them about something, then it's very much a doctor-centered management. What you want to do is in clinical management, you ask questions more about the future. So for example, I tell the patient, I appreciate that you've been trying to lose weight. Would you like to try some exercise? If you want some help, I can offer you some help. So then you see, like, it's a discussion. I'm asking them question. You need to try and see where they are at, whether they are ready to make these changes or not. I appreciate that you're quite concerned that you're very sleepy and tired. What I think you've got is what we call sleep apnea. Have you heard of this? Sleep apnea is a common problem, and it usually causes problems such as tiredness or you're feeling sleepy during the day. It's because when you put on weight, what happens is that you actually struggle to keep your airway open at night because of the excess of fat around the neck when you put on weight. Now, what happens is that when you're sleeping at night, you might not realize, but your sleep is interrupted and you're not getting a good sleep that's refreshing. And when you wake up in the morning, you feel very tired. So there are things that can help to make sure that you get better. One of the things is reduce your weight because at the moment, as you mentioned, you put on 7 pounds, and if you can reduce your weight, it's going to help you. Would you like any help reduce your weight? So rather than telling the patient you need to do this to lose weight, I'm asking the patient, would you like any help? So that way it's better. Or if I ask a patient, have you thought of cutting down alcohol? Like it's different rather than telling them to cut down
Mm.
because then it's coming from them.
Mm.
So this is how I would actually change it in terms of rather than telling them what to do, asking them a question to plant a seed in their mind
Mm.
to for them to start thinking, oh yeah, I need to change something in, right? So
Mm.
that makes a big difference in the treatment.
Okay. And how do you sell the CPAP concept? I find very difficult to really vocalize it.
So the CPAP, you can tell them is that what you want to do here is you want to refer them to sleep clinic.
Mm.
Then they'll be able to assess their
Mm.
oxygen level. And then the CPAP, I'll just say to them that in some cases, if this sleep apnea is severe, then some patients might need to use a device when they're sleeping at night, which will help to keep the airway open. So it's a pressure device that keep your airway open so that you can breathe while you sleep and can have a refreshing night of sleep. If you're struggling with the RCA and you believe that you need help, then I'd recommend that you click the link down in the description below to book a free call to see whether we can work together on a one-on-one coaching program. If I think that I can help you, then we can get you on the coaching program. But if I can't help you, then at least you'll get some insights. I hope you found this video useful. Let me know down in the comment section if you have any questions or any suggestion. Take care, everybody. Bye-bye.